Good afternoon, everybody. This is Shiraz Ahmed with Sartorial Wealth of Raymond James. Thank you so much for taking time out of your day to join us. I also have my colleague and co-host Grant Lashevsky on this call as well. Today, we want to do one thing for you guys, which is to discuss everything COVID. And the purpose behind this is really just to get the straight goods from the horse's mouth directly. So we are very pleased to have two fantastic guest speakers today. The first of which is Dr. Andre Maryniak. He is a resident physician in New York City with Sunny Downstate Medical Center. And we also happen to have Dr. Khalid Pasha, who is also a physician in United States in New York City with Lenox Hill Hospital as well. We're very fortunate to have them both as guest speakers today. First off, I want to just really thank them both for taking time out of their days and really just doing a phenomenal job working on the front lines right now. We do appreciate you guys doing that for the whole world, frankly. So without further ado, just jumping into it. First off, we're going to have Dr. Andre sort of start things off here. I thought maybe from you, if you could maybe share a little bit about, what is the experience actually like for somebody who's been infected by the virus? And, how do you decipher between like a cold and flu or something more benign than something that would be potentially COVID?
Well, the general symptoms that I'm sure we all know or have heard about is the cough, shortness of breath, fever. These are relatively non-specific symptoms. There's a lot of disease that can cause you to have these symptoms. And that's what makes it difficult for people to be able to differentiate between whether or not this is actually coronavirus or whether or not, like you mentioned, this is just the seasonal flu. Really based on just symptoms, it's difficult to tell, and the range of symptoms that people are experiencing with COVID are actually quite big. There's people who get predominantly gastrointestinal symptoms where they're having diarrhea, nausea, vomiting, or not able to tolerate food by mouth. There's other people who just get myalgias and just feel really weak and their muscles hurt. And then there's other people who have the more traditional symptoms where they're coughing and they're really short of breath. And that's what eventually drives them to come into the hospital because they're requiring supplemental oxygen, etc. So it's very difficult to necessarily be able to differentiate between coronavirus and the seasonal flu, which again has made this whole situation difficult in the sense that they're happening at the same time. So a lot of admissions that perhaps have happened in the hospital were possibly regular, just seasonal flu, but based on patients being in the emergency department, being exposed to other people who had coronavirus, I suspect that a lot of people actually contracted it by being in the presence of other people who had it already there. As for typical flu symptoms that you generally see that haven't necessarily been associated with coronavirus, typically people with flu, they'll have a runny nose, they'll have clogged sinuses, they'll have a productive cough, which not a lot of people with COVID are complaining about. I'd say the number one thing that really brings people into the hospital is shortness of breath, where before they were able to exert themselves, walk around without any problems. And now they're complaining of the shortness of breath when they come into the hospital, and we check their pulse oximetry, check how well oxygen is being distributed throughout the body, and you see that it's below 90%, and then you walk them around and it drops even lower, and that's where then you determine how much oxygen they require and whether or not it's just through a nasal cannula, whether it's through a face mask, whether or not in worst case scenarios they require intubation, where you got to attach them to a mechanical vent in the worst case scenario. So that's kind of the spectrum of where it goes.
So I guess, Andre, you've answered a couple. I'm going to throw a couple to Khalid here, and then Grant can do the same going forward. Really just trying to get to, the status as to how you guys have seen the virus progress. We talk a little bit about the symptoms, but, are we currently in a position where you feel that the U.S. is starting to flatten the curve? In Ontario and Canada, in a lot of different provinces, the curve is starting to flatten. But how do you feel the U.S. is progressing on that front, and specifically in New York City?
Sure. So population-based analysis, I think, is difficult because every state's been hit in a different aspect. So based on specifically New York City, from our personal experience, Andre could probably speak to this as well, is that we have seen a decrease in the number of patients and required number of patients who require intubations and presenting to the hospital and the emergency rooms. That has drastically decreased, but it's been a very slow taper in comparison to what the peak was, which was a little dramatic. New York City, financially speaking, is the epicenter of the world economic center for all of the financial markets. So I think that is an important aspect economically for everybody to assess. I think this will be a little more delayed than most other places. We are seeing places like Georgia and Texas being a little more aggressive. We may see the curve flattening a little bit, but a lot of the politicians, the reasonable politicians, are reiterating the most important thing of this aspect of the coronavirus pandemic is testing. So as we go forth and we see that the testing capacity increases, which at least for our hospital system, I can say has increased exponentially. So it has almost doubled within the span of the last 2 weeks, and they're aiming for about 400,000 per week, I think is the goal for globally, at least within the next week. So if we start expanding testing and we know who is exposed, who has a virus, and then we can functionally quarantine those people, and everybody else who's unaffected can result to go back to their economic duties, I think that would be a good transition. I think we're still about probably at least a couple of weeks away before we get an assessment of where we are. At least
on that note, could you talk a little bit about kind of the testing? Like, has this gone wide scale yet? Do you feel the U.S. or specifically, New York, have us past that peak yet? Or talk a little bit about more on the actual testing side.
Sure. So there are two different types of testing that are important. So antibody testing, which folks hear about on the news, and there's something called PCR testing. PCR testing tells you essentially if you are actively exposed to the virus. Antibody testing tells you if you have developed antibodies and you are not susceptible to the infection. The other question that the CDC seems to be trying to address at this point, and also the WHO, is if you have antibodies, are you no longer susceptible for a reinfection? I don't think we have definitive evidence on that, one way or the other. The likelihood, knowing what we know about viruses and viral infections for the longest time, is that you probably do have immunity towards the virus. But that being said, this is a coronavirus, and coronaviruses do transform. So there are different types of coronaviruses that we know about, nothing this dramatic. So we don't know if we're going to see a transformation of the virus and if we're going to see different strains that people are going to be reinfected or not. So that is going to be also very important. Knowing how much of the population is exposed. Currently, at least in New York State, the estimation is about 10 to 15% of the population has been exposed to the virus. Now, for us to get herd immunity, which a lot of folks also refer to, the rough estimate that the CDC puts out is about 60% of the population has to be infected for us to achieve herd immunity. So that is not an optimal approach. So the optimal approach would be for us to understand who is actually infected and how we're able to protect the people that are actually more vulnerable, people with comorbid conditions, people with history of coronary disease, or folks with history of hypertension and diabetes. These are all people who are more susceptible to having severe illness forms of coronavirus. So, making sure that population is protected is going to be also important. In terms of testing, the scale that we're on, at least for PCR, it's readily available. The antibody testing is more difficult because for folks who have taken antibody testing, the first phase is going to be healthcare workers who have been exposed, and more importantly, people who have had symptoms. Once you have symptoms, it takes about 3 weeks for you to develop antibodies. Once you develop antibodies, then it still takes about 4 to 5 days for them to get results. And there's also qualitative and quantitative measures of both. The quantitative measures are what are going to be the most important thing for us to know how much immunity are we actually building towards this, not just a qualitative marker of saying you have immunity or you don't.
Andre, perhaps you could talk to me a little bit about what you guys are hearing from healthcare officials on like timeline for vaccinations and that sort of thing.
Well, just to touch based on what Dr. Pasha said, I think right now they're definitely, at least at our hospitals, they're doing antibody testing. for medical personnel. As I mentioned before he joined, I already had my testing done last Thursday, and that's being run by the Department of Health. So again, close to, I think the numbers from the weekend that Governor Cuomo spoke about was, I think, close to 14% or 13.9 was the figure that he said was the amount of people who've been exposed. And if you extrapolate that to the entire population of New York State, that kind of sheds some light in terms of how many people have actually been infected in general, and in terms of what the actual death rate is. It's difficult to make any extravagant statements, but the suggestion is that perhaps the death rate is a little lower than what's actually being reported. With respect to vaccination, the most recent news that I heard is that's a little bit promising is I think the Jenner Institute in Oxford, England, are conducting phase 2, phase 3 clinical trials for a vaccine that they've shown that's been successful in rhesus monkeys, which are genomically very similar to people. They got an emergency exemption to start running phase 2, phase 3 clinical trials with, I think, close to 5,000 to 6,000 people. That means during phase 2, phase 3 is when you're monitoring not only side effects, but also effectiveness of the drug. And their prospective timeline is they're suggesting that they want to have something ready by September, October. They're already mass producing it, thinking that it's going to be successful. That being said, I say this very cautiously, is these are very hopeful estimates. I think it could take anywhere from months to even years in order for us to actually develop a successful vaccine. And just on the topic that Dr. Pasha mentioned, in order to acquire herd immunity, there are essentially two ways to do it, and that's by immunization and by exposure. Having 60 to 70% of the population exposed to the disease is not the way we want to go, because it's going to overwhelm the healthcare system. So definitely the other way is then through immunization, and I think that's why a lot of resources and funding are going into that field, hoping that that's going to be the solution to this problem.
Absolutely. And Dr. Pasha, anything from you on sort of echoing the statements?
So yeah, I agree with what Andre said. Absolutely. I think in terms of a vaccination, we're all hopeful for a shorter course, but as we're approaching this, just knowing how this is to understand, put this in scale of how vaccinations have been developed. It usually takes years for vaccinations to develop. It's about 3 to 5 year process for any vaccination to develop. Also, this has been the most rapid progression of technological advancements we've ever seen in a microbiology sense and vaccination development. So we have the largest scale private organizations in the world working on vaccinations. There are 3 active trials here that are in current human trials that have been active in America in itself, and there's 7 other trials that are in testing phases for vaccinations here in America, and that's only that I know of in America. There's probably way more, at least globally also, that folks are trying to achieve. So we are hopeful with all of this effort that hopefully within the year, we do have an answer for our vaccination, and that is going to be our answer to how we are able to achieve normalcy again.
So I guess maybe throwing this question to both, maybe Andre first and then Khalid second. Given what you were mentioning earlier, the fact that states by state, they're opening up their lockdowns on a different, I guess, frankly, timeline, given the density of population. Do you guys have some commentary on, if that's a wise choice? Do you feel that there could be the potential for a second wave of infection potentially, which is rhetoric that you hear quite a bit out there right now on, by doing so, if they lift restrictions in some states early versus other ones, could that have an impact on the overall outcome?
In terms of loosening restrictions, I think, again, it's very location specific. There are some areas that have been hit a lot harder, others less so. I think it definitely has to be a collaborative effort. For example, loosening restrictions in New York could certainly affect neighboring states such as New Jersey, Connecticut, etc. So I think it has to be a collaborative effort amongst a lot of states. Because, for example, if restrictions were loosened in New York, people where let's say public beaches were open, parks, etc., people from New Jersey can easily just travel across and then access them in New York and vice versa. That's why I think the CDC has kind of recommended that before we even entertain the idea of loosening restrictions, they want to see at least a 14-day decrease in the amount of hospitalizations. So at least a 2-week positive trend in the right direction, or in this case, it would be a negative trend. And then we can finally start considering how we're going to do this. And again, I know there's been a discussion amongst all these areas in terms of doing it in phases. Doing it, some have 5-phase plans, some have 2, 3, etc. And I think it's in order of if they're going to have to do it in terms of what they consider is most safe. So I think in New York, I was listening to Governor Cuomo say the first thing he would consider reopening is construction and manufacturing. Again, in those industries, there are measures that can be taken where people are protected, where they're still keeping a safe distance, and then every particular phase would be monitored for a period of 2 weeks. And then in the event of success where they don't see any increase in hospitalizations or increase in mortality, then you'd be able to transition to the second phase, which then would be perhaps some opening some more businesses, some more essential than others, and then you'd be able to transition progressively into loosening them more and more. I don't think we can expect anything drastic in terms of any public gatherings such as sporting events, concerts, etc., anytime in the near future, because that's just asking for a second wave to happen. And I think it's going to be a long process, a long haul, and you're going to have to evaluate systematically every single phase. And in the event that they do see that hospitalizations do increase, then we're going to have to retract those restrictions and perhaps tighten them again and try again later down the road.
So I definitely agree with what Andre was saying. Absolutely. I think this is a few important points that a lot of people, I think, miss in this process is they don't understand, I think, the importance of not immediately seeing symptoms. So once you loosen restrictions, we're not seeing symptoms within days, right? So the important part about the disease process here is that it takes at least 2 weeks in a lot of people, right? And that's 2 weeks for you to be exposed to the virus. Say you're asymptomatic, your state loosens restrictions. You're visiting folks who are elderly, who have comorbid conditions. You give them the virus, it takes them about 2 weeks. So now we're looking at a 4-week process before we start seeing the results of loosening your restrictions. The important part about this pandemic here is that everyone's actions reflect on all of your neighbors, right? That's the most dramatic thing, is that what you do, what I do, what Andre does, what Grant does, reflects on what happens to each one of us in our families. So I think loosening restrictions without having the proper measures in place is very dangerous and is what puts us at risk for having a second wave. So there are 3 important aspects that we have to address before we can start loosening restrictions. One is testing, which is the most important. We have to be able to test everybody that may have symptoms. Second is keeping a very close eye on the number of patients that are coming to hospitals, active cases. And then, so keeping those 2 in place. And the third is knowing how much of our population has been exposed. Those 3 important factors, if we can keep an eye on those very closely, then we can continue to monitor what our businesses are doing and slowly let companies come back in phases, like Andre had said.
Thank you for both that, guys. One question I have, and I think many other people do, are, mask and gloves, right? Some medical professionals are suggesting not wearing them and just washing your hands simply. Others are suggesting, to use medical grade type of equipment. First question is, what are your suggestions for people to wear or not? And then the second question along those lines are, where would you recommend individuals go for relevant and proper information? We've talked about earlier in this webinar that there's a lot of information floating around out there. So is there some areas and some places where you would recommend people go for proper data?
Mask and gloves, I think, at least in New York, it's now mandated for any public spaces for you to wear mask and gloves. Things like when you're going to the grocery store, I highly recommend it. You know, that's a place where you have large public gatherings, even though they're restricting the number of people that go in. Definitely homemade masks. Surgical masks are not necessary. I know PPE, at least in the hospitals, is still limited. And this is not just a local problem at your hospital. This is going to be a global problem. You know, and that's going to extend to South America, to Africa, to Southeast Asia. These are all places that are going to also need PPE. There were some very nice videos, even by actually Dr. Sanjay Gupta has a nice video of a handkerchief, folding it and using elastic bands and hair bands and making a nice mask out of it, a homemade mask that functions very nicely. Gloves I would also recommend, and obviously hand washing and using hand sanitizer. Again, the 20-second mark, which has been recommended both for hand washing and sanitizer. People should stick to that.
Yeah, just to add on to that, I think being vigilant about hygiene is paramount at this time. It's the least that we can all do. Wearing a mask and gloves is not necessarily a big burden to people. It's not necessarily uncomfortable. It's something that you're doing when you're going into public spaces. The least you can do is put it on when you're going to a grocery store, if you're using public transport, etc. Obviously, it's not perhaps necessary when you're at home or confined amongst your family members to be walking around each other in masks. Of course, that depends on whether or not you have people who are infected in the house, etc. There's a lot of variables. Now, in terms of the second question you had, in terms of getting good information, I think it's difficult at this time. One resource that I'm particularly using, and I think it's been really helpful, is the Johns Hopkins Coronavirus Resource Center, where there's a lot of trends that they're showing, not just locally here in the US, but as well as internationally. They're answering a lot of questions in terms of what's being done for testing, whether or not the curve is being flattened, etc. Obviously, getting information from this directly from the CDC is going to be as accurate as you can get it. I think for people who perhaps are less acquainted with science, biology, etc., I think the Netflix documentary that they did explaining coronavirus that recently came out 2 days ago was really good in terms of explaining simple concepts of epidemiology, discussing things such as herd immunity, describing infectivity, describing the R naught, which has frequently been thrown around in the media. So if you start from the basics and then escalate towards things such as the Johns Hopkins Resource Center, I think another thing at this time is there's a lot of information circulating amongst academic centers. There's a lot of tests being done here in New York. There's a lot of tests being done in China and Italy, etc. And I think it's really important at this time because we don't necessarily have definitive answers. A lot is being learned as this process is ongoing. For example, I can speak on behalf of some studies that have been done, at least locally here in New York, in terms of originally there was some indication that perhaps flaquenil and azithromycin in combination would have been the treatment of choice for coronavirus. Yet some more recent studies right now are saying that it doesn't really offer much of a benefit. A lot has been also, there's other medications that people have spoken about in the media in terms of like remdesivir or IL-6 inhibitors as well. Originally, perhaps there was some suggestion that they were really beneficial. Now, more up-to-date studies are really saying that they're perhaps most beneficial in only very critical cases. So again, we're learning a lot as all of this is happening. It's difficult to jump to conclusions and to say one thing is true and the other thing is not. I think there's a lot of ongoing research, but definitely using those resources that I mentioned are probably the best way to go about getting good information.
So Andre, I guess this is a question for both of you, but just personally, and this because it goes to where do I get the information from, but like I've been terrified to order Uber Eats, not because I don't want to, like I'm craving a cheeseburger, right? Like, and I just wanted to like, but do I wipe down the whole like what do I do when that guy delivers?
Yeah, I mean in terms of like what we mentioned, like the virus survives on different surfaces for different periods of time. Fortunately, what we use in terms of food deliveries, it's cardboard, it's paper, which I think the studies have shown that it survives the least amount of time on. I think somewhere maximum like 3-4 hours. So that's a benefit rather than, let's say, steel or other metal surfaces where it can survive for days at a time, right? I think you don't necessarily have to be overzealous and start sanitizing and bleaching every single surface. I think that's unrealistic, and psychologically that's just draining, because then it perpetuates a cycle of hysteria and just hypochondria. You become a hypochondriac, and but again, it's just doing the simple things. It's washing your hands. If something does come in, when you unpackage it, dispose of the packaging immediately. You don't have it be sitting around there. If you want to be extra vigilant, unpackage it with gloves, dispose all of that, and then maybe not eat it directly out of the cardboard that it comes in. Put it onto your typical dishware, etc. Just simple things like that. Again, I don't think that's necessarily should be the primary concern for people. Again, this is primarily, although it is contact spread, I think primarily droplet spread is what we should be concerned about, and that's why there's this emphasis on wearing masks, etc., keeping 6 feet of distance between people.
And so there's also like 3 different ways that we have to understand that the virus transmits. It's not going to go, Andre and I know that there's different types of transmission. One is through the GI tract, gastrointestinal, right? So that has a different type of immunoglobulin that attacks. It's something called IgA versus something that goes through.
So how does someone contract it that way? For a simple person, what does that mean?
You don't. So the coronavirus is not contracted through the gastrointestinal tract.
Okay.
So it's not on food. So the way it is transmitted is through your mucous membranes, which are essentially located in your nasopharynx, your nose, in your lacrimal ducts, which are in the middle aspect of your eye, and more or less at the oropharynx, which is your oral area, which is how you get it through droplets. So once it goes there, it goes into your respiratory tract and starts transmitting to your bloodstream through that. So you're not going to get it through a GI tract.
Let's just say, walking through the scenario that, God forbid, somebody did end up contracting the virus. There's a lot of, referencing to, self-isolation, things of that nature. But when you're in a cohabitation situation where you have a family, that's not always necessarily the easiest thing to do, or even in confined spaces. Lots of people live in apartments. Do you guys have guidance that you can maybe share with people on how is the best way to go about actually doing a self-isolation scenario in the event that you do get contracted with the virus?
I think, again, it's a very it's a question that depends on everyone's individual circumstances. If you're living in a 1-bedroom or studio apartment, it may be difficult for you to isolate from your partner versus, let's say, people who are living in larger homes in the suburbs where they can have someone be confined to a basement or an upper floor, etc. I think some of the solutions that have been made here, at least in New York City, is some hotels have been offering people that's been a kind of way out for people to go and self-isolate if they've been identified as being infected with the disease, rather than returning home. Obviously, keeping someone just confined to 1 bedroom, doing as much as you can in terms of closing doors, being vigilant, again, as I mentioned, in terms of hygiene, washing your hands, wearing masks around these people. It's hard to really say, to give you instructions that absolutely everyone could follow, because I think it's very individualized, but those are some strategies that I would definitely employ.
I think it's very difficult to have a generalized strategy for folks, but knowing the importance of social isolation is important. Furthermore, I think the idea that if you have been exposed, the likelihood that you're not going to expose your partner is absolutely false. This is a very virulent virus. So if you have been exposed, the likelihood that you're going to expose everybody in your house doesn't mean that they're going to be symptomatic, but the likelihood that they will also get the virus is exponentially high. So you have to have that understanding. So don't be lackadaisical about it. So if you have the virus, be very attentive to that, the idea that you have to isolate yourself, and that exposing yourself to just your loved ones also exposes furthermore to people that are in their extended circle, if they're seeing their parents on the weekend or something odd like that, which we don't recommend.
Absolutely.
Sorry, going back to, just if I could add something to what Andre said, in terms of looking at treatments, there's a lot of information out in the media about treatments. What I would recommend the general public to do is to defer from, diving into the treatment options. People are always looking into options, and we're all in this together, and we're all hoping that one day one of the treatments is going to come back and have positive results. But medicine is data driven, and until we have definitive data, all of this stuff is anecdotal treatment. Even the hydroxychloroquine Plaquenil, which has been politicized in the news one way or the other, we can't definitively say it works or it doesn't work. There's data both ways. So until we have definitive data that comes as a recommendation from the CDC, we shouldn't make recommendations or try and self-treat ourselves in any other way. Use your physicians. We're here to help you guys, and we're like motivated to lead this effort.
Perfect. Thank you both for answering that question. So I think just in the interest of time, we're going to try to wrap it up. I think Grant's got one last one for you guys. So Grant, if you want to take it away.
Well, I really want to open up to both you guys, really just on last thoughts. Being in basically North America and epicenter in New York, you guys have a tremendous amount of experience and knowledge that we'd like to share with anyone watching this video. So, perhaps, Andre, you can start off, and then Khalid, you can finish just with kind of last words and anything you think would be important for any of our viewers or the general population to know.
Okay. Well, generally, as we discussed at the start, I think it's a consensus now that this is really serious. It's no longer a joke. I know that originally when it first began, people were skeptical in terms of how serious this actually was. I think that question has already been answered. I think what we're doing collectively in terms of self-isolation right now is really promising, and it's the direction we need to go in terms of us finding a solution to this. Of course, there's a lot of efforts going into vaccination. A lot of that is out of the general public's hands. That's down to the researchers. I think what we need to exercise right now really is patience, and it's the hardest thing to do. It's psychologically draining having to sit at home. It's very difficult hearing about family members, etc., who are perhaps sick or not doing so well. It's extremely difficult for families of people who are actually hospitalized, where they're not able to visit them in the hospital and say their goodbyes. It's a tough thing to do, to call their families in the middle of the night and be like, your loved one has passed away, and they haven't had the chance to actually be able to visit them, etc. So there's a big psychological aspect to all this that's perhaps not being addressed. But I think if we just continue to be patient, continue to do what we're doing, and just exercise a lot of caution in terms of loosening restrictions and not doing things too prematurely, I think we'll get through all this. My personal opinion is that we're moving in the right direction. Again, it's just a matter of not making any rash, premature decisions and taking it day by day, because it will take time for us to eventually get out of all this.
I think Andre said something very important there. The key word he said was patience, which the most important thing in our approach now has to be patience. Not only as healthcare workers do we have to be patient now that we realize that this is our new reality. We're seeing this on a day-to-day basis. We're not seeing this fizzle off. We're not expecting this to be a one-month battle. Our lives have dramatically changed, at least in the healthcare field, and we're not expecting things to return back to normal or normalcy until we have a vaccination. So that I think will carry over to everything. Hopefully, as we're using our social distancing measures, physical distancing measures in every aspect of our life, even as we open up businesses and we see that the infection rate decreases, that those measures will be monumental in helping everyone stay safe through this very difficult process. Because the last thing we want to do is go back and undo all of the work that we've already done over the last 6 weeks. So that is going to be very, very important. So it's difficult for everyone. People ask us if it's difficult for us in the healthcare field, and I say it must be difficult as hell for people who don't have jobs right now, people who can't bring a paycheck home. For us, at least, we're going to the hospital, and yes, it is very difficult, but there are also many psychosocial factors here that we have to consider. And even as we go forth, we have to be patient. We're going to get through this together. That I know for sure.
Absolutely. No, and you guys brought up really good points. And one of the ones that, everyone's sort of in the back of every person's mind right now is, I think policymakers have a really tough job right now is to weigh both the healthcare needs and necessities that we all have with also the needs of people to be able to earn a wage and be able to put food on the table and not necessarily relying on sort of some sort of universal basic income supplementation that they're currently doing, because it's not a road that anybody can go on for too long. So no, I really appreciate you guys taking time out of your days to, have this chat with us, and hopefully it provides some value to everybody out there who is listening. We, on our behalf from here in Toronto, we wish you guys the best, and hopefully you stay safe out there. This is not an easy time, but keep your heads up and keep fighting the good fight. So thank you.
Thanks for having us.
Thanks. Thank you guys. Stay
Thanks,
safe.
guys.